The Ministry of Health partners with Scotia Bank and the Pan-Caribbean Partnership to commemorate Regional HIV AIDS Testing Day Wednesday as they seek to reduce the number of HIV AIDS cases in the Caribbean. Sherilyn Beza has the details.
Acting Country Manager, Scotia Bank, Gordon Julian, says Regional Testing Day provides increased confidential opportunities for persons to be tested, whereby 2,300 persons were tested regionally in the first year, and that figure doubled in 2009. Parliamentary Secretary Senator Malika Parker, in expressing pleasure in being associated with this nation-building exercise, expounds on the theme, a healthy lifestyle, getting to zero new infections.
It may not be easy, and many of us may not be willing to make a similar link between the spread of HIV/AIDS and lifestyle choices. It is a hard thing to do. It is a leap for many of us, and it is a leap for a certain category of us. This is where, my friends, the issue of life choices and the notion of responsibility becomes frontal in our discussion. As individuals, we must appreciate that HIV/AIDS depends not only on the individual, but on the collective.
Permanent Secretary in the Ministry of Health, Edson Joseph, suggests testing also be done in churches.
I put out an idea and a challenge to Scotia Bank to find some religious institution that they can partner with in 2012. Where only that the testing will not only be done at Scotia Bank, but we'll be breaking down barriers and building new relationships, meaningful relationships, to maximize the best benefits and to lead to greater partnership and greater effectiveness in the whole fight against HIV and AIDS.
He adds that the church is where most persons can be reached who would listen to their priest, pastor, or bishop and be tested. Chief Medical Officer Dr. Rhonda Seeley-Thomas explains the initiatives through which the impact has been reduced on patients and their families who are indirectly affected.
These include, but are not limited to, our program for the prevention of mother-to-child transmission of HIV and AIDS, voluntary counseling and testing services in many of our clinics and institutions, to provision of standard drug kits for managing sexually transmitted infections by the Ministry of Health, engaging the services of our clinical care coordinator, the provision of free antiretroviral medication for persons diagnosed with HIV, and the establishment of a human rights desk at the HIV/AIDS Secretariat.
Dr. Amina Goodwin-Fernandez, Clinical Care Coordinator, explains why it is important for persons to be tested early and regularly.
Persons will be infected with HIV/AIDS and not have any symptoms and have absolutely no idea that they're infected with HIV/AIDS until their immune system has been quite significantly weakened, by which time there are complications which can be almost basically HIV is the virus, human immunodeficiency virus, which infects the body, and there's a latency period between the time of infection and the time of developing AIDS, and that latency period can be for as long as, well, average maybe about 12 years, but it can actually be for as long as 20 years. So you can well imagine that in that 15 to 20 year period, this infected person is transmitting infection to other persons.
The first case was diagnosed in 1985, and the epidemic is concentrated in the 15 to 49 age group. Sherilyn Beza, ABS News.